All right, good afternoon, everyone. This is Sean Kennedy. I am the Director of Health Information Exchange here at the Massachusetts eHealth Institute, and I want to take this opportunity to thank you all for taking the time out of your lunchtime to join us for this monthly webinar series we have on Health Information Exchange. We've got a great group of people ready to share with you a bit more about effective and proper use of the HIway directory. So let me start by doing a quick intro to the Massachusetts eHealth Institute. For those who are unaware of who we are a division that sits under the Massachusetts Technology Collaborative, a public economic development agency. We've got two sister institutes, in the Innovation Institute and the Mass Broadband Institute. Together, the three of us work together to really grow the innovation economy, lay down an infrastructure for broadband connectivity, and really enable that e-health connectivity across the state. HIway is the state designated entity for coordinating healthcare information, technology, and competitiveness, accelerating the adoption of health information technologies, promoting health IT to improve safety, quality, and efficiency in healthcare here in Massachusetts, and really focusing on advancing the dissemination of electronic health record systems in all healthcare provider settings. We like to think of ourselves as that go-to resource for all things health IT. Today, we've got a great group of people that are going to be sharing our presentation. Two primary speakers. We've got Mark Belanger. He's a Director of Advisory Services at the Massachusetts eHealth Collaborative, and then Ryan Thomas is a Service Manager at the HIway Operations Team. Mark's going to go ahead and kick off our presentation. Just a little bit more on Mark. He is an advisor and subject matter expert for the HIway and has helped with the design and rollout of the program since 2011. Mark also supports the Health IT Council and facilitates the advisory groups that inform the Council and HIway leadership.
Today's presentation goals are really to give you some information to help you access and use the provider directory. We're going to go over some basic setup about what the HIway provider directory is and isn't, and what its purpose is. We're also going to talk about this in context a little bit with how the provider directories are rolling out nationwide and why many of them are failing, and why we're making some of the choices we're making here to set this one up for success. We'll get pretty tactical about how we get data in, as users of the HIway, how we can get data into the provider directory, how we can get it out, and how we can maintain it so that it stays current. We'll do a couple of FAQs that we're hearing a lot. Many of you probably have a pretty good idea by now what the HIway is. It's a secure statewide health information exchange network. This was launched in October of 2012, and it's operated by the state, the Executive Office of Health and Human Services. It is basically a direct secure messaging platform, meaning that it is the basis for secure and trusted exchange among the provider organizations in the state. The goals are very aligned with Triple Aim, and you can see them here. Certainly the HIway sees its role as increasing information liquidity in the state in support of care quality and safety, reducing costs and duplication, and improving patient outcomes and satisfaction. This is hot off the presses for where the HIway is today. There are roughly 230, actually it's not hot off the presses, there are several more participants as of the last couple of days. But we're north of 237 participant organizations that are on the HIway or at some stage of signing up and getting connected. This continues to grow very quickly. We have an account management function right now, and there are several account managers that are working to grow the network as rapidly as possible. For those of you that are participants, we are working in a kind of a co-selling mode. So as you come on board, you're likely looking at trading partners that you really want to work with. We're asking you to let us know who they are so that we can go out and approach them, or approach them with you and bring them on, so that we can grow this network as quickly as possible. So the network right now is fairly broad. its use is still fairly nascent. There are about 32 organizations that are using this network very actively. This is also growing every day. Those organizations are transacting roughly 500,000 transactions a month, and that cumulatively, the HIway's up over the 4 million transactions mark at this point. A lot of the early use of the HIway has been around providers sending to the quality data center and providers sending to public health. More recently, we've been having a lot more provider-to-provider exchange for care coordination and provider-to-payer exchange for purposes such as HEDIS reporting, population or case management, and chart review. So getting more specific into the provider directory part of this conversation, you know, that one of the things that the HIway can do well that's kind of a gap in the state is being able to let people understand who they can send and receive direct messages from. So it's been identified as a really high value thing the state can do is to put forth a directory of addressees or places you can send to, and also to be the broker of trust. So if you think about, you know, this is not just a phone book. This is actually, if you look behind the addresses, they do a lot to establish trust in this community and to represent that trust to others. So I want to just take a moment to talk about some of the features, the security here that's built into these direct messages. As each organization comes on the HIway, they're given a domain, and that's the part of the address over, in this case, in this example at the top, it's hospitalb.masshiway.net. That domain is given out only when that organization has been trusted and basically authenticated and agrees to work within the rules of the road for the Mass HIway, within the policies and procedures. At that point, there's an access administrator within each organization that's given delegated trust, and they assign the rest of the address. And that's the part, in this case, Marilyn.Smith. And they're able to go ahead and make sure that that person is trusted within their organization and authenticated within their organization. So you have a string of trust all the way down where this address represents somebody or a department or something, and you can be assured when you get a message through the HIway that that trust exists. This has been built on the direct spec, and the idea was to establish some kind of fundamentals of trust. One is confidentiality. So these messages are coming over. They're encrypted using a certificate and decrypted when they arrive at your organization. So they are fully private. Authentication, we've assured that everybody is who they say they are and won't be misrepresented. Integrity, if any message is altered in transit, it will not succeed. It'll fail, and you'll be able to identify any tampering. And then the idea of non-repudiation, meaning that the message is signed with a private key that proves its origin. So that's the basis of direct and its establishment of a trust community. So that's why the provider directory is important, because it points out who's trusted and how I can reach them. The workflow from a patient point of view in this diagram, the patient comes into this primary care physician. They give their consent to have a message sent over the HIway. In this case, the provider doesn't know the destination address of Hospital B, and they use the provider directory to look up that address. They address a message, and they send that message. It might be a CCD they send it with, or it might be something else. And they send that message over to Hospital B. They don't need the provider directory in this case if they know the address already. Much like today, if you don't know somebody's address in email, you don't necessarily have to look them up somewhere. So provider directories are very new in healthcare, and they're failing in many, many places. And so we're very cautious about coming in and trying to do this right in Massachusetts. For one thing, there's no widely adopted provider directory standards in the market right now, meaning that there are some standards out there, but they're not at a point where they're mature enough to really say that everybody's using them. Okay? So that leaves kind of a gap where we need to do some inventing on our own. The other major point is nationwide. A lot of HIEs have gone out and tried to build provider directories. We actually studied several of these under an ONC grant about a year and a half back, and found that most of these PDs try to do everything and be everything to all people, and then they just die under their own weight. They try to collect every piece of information under the sun for multiple programs, such as health insurance exchange, health information exchange, etc. And they end up becoming really cumbersome. The HIway provider directory has a set of design principles that the team is trying to go after and improve upon every day. The first is starting with a single purpose. This provider directory is really just for finding an unknown destination address for direct messages. If we can get that right, then we can start thinking about the other purposes and build upon that success. The second idea is something that is a moving target, and that's trying to lower barriers to use. Right now they're fairly high, and the team is working to reduce these. The first is trying to make it really easy to collect and change the data set that's gathered from each of your organizations. The second is trying to make it easy for the provider directory to be used and to access. In many cases, you are going to access the provider directory from behind your vendor, your EHR vendor, and it's not even going to look like something that's from the HIway. So we've got to do everything we can at the HIway to put a stake in the ground with a very simple web service that others can work with, and provide a lot of flexibility. So if they can't do it one way, we provide it in another way. And then this idea of sharing data where there's mutual trust in place. The HIway has been very fluid about trying to decide who it should share provider directories with. The market's evolving quite a bit with health information service providers, or HISPs, emerging, some vendor HISPs, some community HISPs, and there's a policy team within the HIway team that determines how we can trust one another, and where there is trust, to begin sharing provider directories back and forth. So the first idea is, how do we, as users of the HIway, how do we get information into the provider directory? So the first thing is, the HIway will determine what the domain name is. That's the part at the end of the address. You can request a domain name, and the HIway will do its best to match your request. But it needs to be unique, and it needs to have a certain format that makes it easy to identify you in your organization. So in this case, we've got a domain name of South Shore Hospital, represented as direct.ssh.masshiway.net. Now, as described earlier, that domain name is tied to your certificate, and that's what ensures that there's trust, and that the HIway uses to encrypt and decrypt messages. You, as a participant, then have some choices around providing the participant part of the information. And you're able to do this at a range of levels. And this is probably where the most kind of soul searching is going to be needed to determine how you want to be represented on the HIway and how your workflows are going to work. So you can set your addresses or your destinations at the organization level, or at a department level, or at an individual level, or any combination of those. In this case, we've got some examples of South Shore Hospital at direct.southshorehospital.masshiway.net. That's an organizational address. Let's say your organization wants to bring everything into a single point and then triage it out, that's one way that you can set up your address. The second example is one where there may be an existing workflow that works through a medical records office or a department, and that's an example of how that could be set up as an address. The third is the idea that maybe there are workflows that you have that you want an instant response for. This is one that came up at the HIT Council meeting this week, where there may be times when you want an organization to be responsive right away, and may even have an emergency line where direct messages go to a specific emergency box, and the organization represents that they will monitor that 24/7 in order to respond. Or the last example might be Dr. Long as an individual addressee.
The first piece on the slide, which is what we provide, which is the domain name, which the participants will let us know, is that is a direct correlation to the provider directory organizational spreadsheet that needs to be filled out, and that's where the domain is generated from. The participant provides the provider directory spreadsheet. So that's the second spreadsheet that actually goes to populate the provider directory. We'll talk about that in subsequent slides, but I just wanted to kind of cross-reference it at this point that, in our current state, there are two forms that need to be filled out, one being the organizational spreadsheet for the domain name and the provider directory spreadsheet for population into the provider directory with the full direct addresses for the participants, or departmental or organizational.
We're asking for a minimal data set at first. In this idea of keep it simple, there are a minimal number of required fields, and we'd ask that you can just provide at least those minimal fields. If you would like to provide the optional fields, great. It makes it easier for others to find you, but we don't want to slow anybody down. There's within this collection spreadsheet that Ryan's referring to, I think we're on version 17. Each version gets a little simpler. So I think version 18 you'll probably see with fewer required fields as we continue to simplify and make those easier and more streamlined. And then you don't want people to forget the fact that they can go out of band. We expect as the HIway rolls out that you're going to contact those that you really want to talk to over the HIway, and that you may, use their phone number, which would be provided in the HIway, or if you just know it, to let people know that you would like to send or receive over the HIway, to talk through, where you should send things to, what types of files people are able to consume. There's going to be a transition period here, where there's going to have to be some communication outside of the HIway to make sure it starts to work well. Ryan was referring to a CSV file. Now this is kind of the current state is to get information in using a bulk upload from a file. Because it's a bulk upload, everybody's asking that you stay within the rules and keep the format the same. And the idea, though, is to move quickly to a self-service state. There was a great call this morning among several of the state's largest organizations, and I think one organization stated that if we could get this right, the provider directory could be the crown jewel of the HIway. And I think what we would like to get to a point is where not HIway is the steward of the directory, but it's set up so that you can go in there and make your changes and do your additions by yourself. I think there were two examples this morning where there were interns and residents turning over in the May-June timeframe by the thousands for these organizations. So there's a pretty major set of operational processes that'll have to happen for each one of those. So The current state is a little bit clunky, and we appreciate you hanging with the HIway as this is figured out. The future state is to move to a self-service model. And the other big point here is that the Mass HIway maintains it. The participants really are going to control what gets published. You determine what you're going to represent as your destination addresses to the world. And there are opportunities to evolve that and make those changes over time to get it right. We expect that's going to take a little bit of time. Getting data back out. So how do you actually consume the provider directory? The first way, the way that we think most people will be using the provider directory a year from now, is within their EHR system, and that it will be fairly invisible to people that they're even calling the Mass HIway provider directory. This really requires that those EHR vendors are able to consume the provider directory. Right now, not many of them are able to, and that's enormously frustrating for several of you, or for many of you. We are working hard with each of these vendors to try to get them to a point where they can do this. Many of them are very new to the idea of even doing secure messaging to people outside of their organization, and taking it an extra step and being able to address is proving to be more difficult than you would think with some. So this is a moving target. We would ask that you continue to put pressure on your vendors to get this up and running. The web service is available today, and it may be consumed by those that are technically capable of sending. The other place that people can access the provider directory is those that have webmail accounts. And we'll show you some screenshots about how that looks and how the search looks. And then it's also possible to call the provider directory via the LAN device with a web service there. So some of you are hooked up using a local access network device or a LAN device, and you're able to use it. There is a big workaround right now to deal with the limitations of the vendors. And basically it's to say we're going to provide a PD extract, a provider directory extract flat file that may be consumed and uploaded in the interim before people can handle the web service. So if you want us to be sending this to you regularly, let us know. You can do that by contacting your account manager, or let us know through the chat feature today if you'd like. And that will you get a regular update. Again, it's a little bit clunky. It's not meant to be the final solution. It's a solution to get us through this interim period.
Yeah, and Mark, one thing I'll add on that last slide is that one of the big things about the provider directory, as we mentioned, it's up to the participant to understand how they're going to be represented in there, and to send in the provider directory spreadsheets to be loaded. I think it's important to pause for a second and understand, I know I spoke about the two spreadsheets, the organizational spreadsheet and the provider directory spreadsheet. The provider directory spreadsheet is the provider directory, is the file that gets loaded directly into the provider directory. The organizational file is strictly for creating the domain name, and by sending in the provider directory spreadsheets, those will get populated to the provider directory. There are many participants out there today that have only sent in the organizational spreadsheet, which they've gotten a domain created for them and they've been able to engage in testing. But until organizations send in that provider directory spreadsheet, they will not be represented within the provider directory. That provider directory spreadsheet that Mark's been talking about is vital to actually being represented in that provider directory. So if some of you have received some of those PD extracts that Mark mentioned on this slide, and you're expecting to see an organization that is connected to the HIway, but perhaps there's no addresses that are associated, a good reason for that is that organization may not have yet provided the provider directory spreadsheet. And that goes for if they want to be represented in the provider directory as an organization, departmentally, or as individual providers. So I think just an important piece to grasp is that even though you have a certificate and you filled out that organizational spreadsheet, to be represented in the provider directory, you must fill out that 2.17 version of the provider directory spreadsheet.
I've got a couple of screenshots just to show you. I mean, this is provider directory is a bit of a difficult thing to show because it's mostly going to be shown within EHR system. But for those on webmail, this is what it would look like. There's an autocomplete here, which acts similar to what you might see in a email program, where you can start typing an address. And some fields are available here that help you deduplicate or avoid hitting the same person. So let's say you've got Dr. Lee likes to, he points out that his name is duplicated all the time, so we'll use him as an example. If there are two Dr. Lees, you'd be able to see the organization name represented here as well. And you may also see, I believe, the specialty, if the specialty has been populated. So you'll have a little bit of extra information to tease out which Mike Lee it is. And again, remember that if there is any worry that you might be sending sensitive patient information to the wrong person, there you can always pick up the phone and verify an address of somebody. So recognize that we will have some out-of-band type processes in the interim. There's also an advanced search within the webmail that allows you to look at these fields. The web services, however, I mean, as many fields as we have in the provider directory, you'll be able to search upon based on, the EHR vendor that set up the interface. Last point is around data currency, and that's that use case where you've got somebody or several thousand interns and residents that are switching out, for example. It's the responsibility of an account manager within each organization to make sure to make those changes. The same set of spreadsheet tools are used to make changes as to do the initial upload. And you can just use, there's something called an entry status, and you can do an add, an update, or a deletion and make the changes that way. It's really up to each participant to keep current, and we ask in the policies and procedures that if you do let somebody go, if you terminate an employee, that to make that change immediately and get it over to the HIway so that they may be taken off the provider directory. All right, we've got a couple of FAQs we'll go through really quickly. I'm going to skip the first one because we've actually answered it with the earlier slides. The second one is, how can I specify a format for the direct email username? And you can specify that within the provider directory upload file under the field called requested email address format. If you have questions on this, each participant of the HIway has an account manager that if you don't know who that is, please let us know. And we'll make sure you do know who that is, and they can help walk you through this. The other idea is this one of having a shared webmail mailbox when adding new users. If you have one mailbox for multiple users, you can specify this in the provider directory as a shared mailbox address. This is something that's only for webmail providers. And then this has come up a lot. A lot of people are ready to send. It's really kind of an interesting time in the market. Many people are highly motivated to send right now because of meaningful use. But a lot of people simultaneously are really reluctant to receive. And a couple of people have called the HIway to try to broker this. In hoping that the provider directory can be used to block traffic. It's really not set up to block traffic. So the provider directory is not going to be able to show you who's ready to receive messages, or it's not going to show you at this point what type of messages you're ready to receive. So a common common theme of this whole webinar is when in doubt, go ahead and contact those trading partners that you're trying to work with and figure out what they're ready to receive or not ready to receive and how. Another thing that has come up many times is organizations are using or trying to use the provider directory to figure out who they can send to meet meaningful use. You know, another resource we can offer here is to use HIway.net website, and that provides a current list of the organizations that are on the HIway. Again, you can also contact your account manager. That person can help you figure out who is on that you want to trade with, and also recruit people that are not on.